Of all these negative tests, some might need to be redone.
That's because the timing of your test after exposure affects the outcome. I spoke with the preventative medicine specialist and former Schenectady County Health Commissioner, Dr. David Pratt, about all this.
But I would say that the exposure that he had in Cleveland was negligible.
Dr. David Pratt is talking about the exposure Joe Biden had to President Trump. As he points out, the CDC definition of a bona fide exposure to COVID is being 6 feet or less from an infected person for 15 minutes or more unmasked. The two men were about 12 feet apart. In general, when should you test after being exposed to someone with a confirmed case of coronavirus?
Well, we know that immediately after exposure, the test tells us very little.
That's because incubation, the time from exposure to showing symptoms or when your system shows you have COVID, is on average 5.5 days, explains Pratt.
But if you look at the curve from exposure to test positive, it probably begins as early as 3 days or 2.5 days.
Because of the potential for false positive or negative results, repeat or confirmatory testing is important.
If you get to 7, 8, 9, 10 days and no test positive on the part of Mr. Biden, I think you can be assured that A, he hasn't infected, and B, wasn't exposed by the president.
By reviewing video of the president's travels after the debate, it's known he came in contact with many people on campaign stops before learning he was positive. So what needs to happen to slow the spread?
We need to do a meticulous job at testing, tracking, and tracing.
Adding everyone meeting the CDC definition of an exposure needs to be tested now and into the future. Something for us all to keep in mind.
A test, through the incubation period begins to tell us whether you had a bona fide exposure or not.